45-year-old Rina Simadi has been living with HIV for 11 years. She has been on treatment for 10 years. But she says for others, it's much challenging. Stigma and discrimination has led to some people living with HIV to abandon their treatment. This in turn leads to a high mortality rate.
We still have a challenge because of staff attitude at the facility, and then shortage of staff, and then young people, they cannot access medication because of staff attitude from the facility.
Advocacy group says the COVID-19 pandemic widened inequalities, making the fight against HIV more challenging.
Therefore, we've seen that the numbers of people who were lost to follow up to treatment doubled. So it's hard for the metros especially to catch up.
Young women remain the most vulnerable.
Especially we are focusing on our high-risk populations in the informal settlements with our adolescent and young girls that are shown to have a high prevalence of positivity rate between 15 to 24.
But for young people, especially girl child, we're encouraging them to make sure that they use protection.
Gauteng's Premier says the high infection rate and the defaulting rate is a setback in the 2030 target.
This particular view that we can live long without necessarily taking medication also contributed to defaulting. So that is what I'm saying. Now that we have gone beyond COVID, we just have to regroup and gallop as fast as possible, because 7 years is not far to 2030.
He also called for stronger measures to safeguard health resources, especially against undocumented migrants.
We can't just have any other person coming into our country, take our medication and go out of our country to cure their own people in their own area. We need to put sophisticated systems for us to manage our resources.
Meanwhile, the provincial government urged everyone to get tested for HIV and to follow a healthy lifestyle. Patricia Vasache, SABC News in Pretoria.